Hello, and thank you for joining us today. We are here to discuss advocacy. What does it mean? How do we advocate and why it matters for our foundation and scleroderma? With us today is Josh Fein of the Health Medicine Council. Josh is the foundation's legislative consultant in Washington, D.C. He is here to discuss more about how advocacy works. Thank you for being with us today, Josh. This next slide is a high-level reminder of the points we will discuss today. As a reminder from the notifications that we sent out, the National Scleroderma Foundation is a nonpartisan organization. We are fortunate to have strong working relationships on both sides of the aisle that have resulted in continued advocacy success for our community. Please keep your questions germane to our discussion today. We will not answer any political questions. With that, let's start from the top. Josh, tell us what we mean by advocacy and why it is so important.
Hi, Ashwin. Good to see everyone. Thank you all for being here today. Just a quick introduction. My name is Josh Fein of the Health Medicine Council, and it's great to meet everyone and talk about advocacy and what's going on in Capitol Hill. Advocacy is part of a coordinated nationwide effort by grassroots advocates to help advance research, increase research funding, and improve overall health and healthcare. Individual advocates work together with one voice to influence a critical mass of legislators to create meaningful change. Advocacy is how you can use your story to raise awareness and try to make local connections with your personal members of Congress, with your senators, by educating lawmakers about issues important to the scleroderma community, issues that we're going to explain in more detail a little later. There's a good chance that many of your lawmakers have never heard of scleroderma, which is why informing them, telling them your story, talking about the symptoms, diagnosis issues, and treatment options is so critical. The government, and specifically your elected officials, make many important healthcare policy decisions, from federal research funding to treatments, to coverage and out-of-pocket cost issues. Making your voice part of these decisions is critical to ensuring the best outcomes on all of these issues for our community.
Thanks, Josh. That was a very good explanation about advocacy and its importance for scleroderma. Moving on, as we talk about making connections with lawmakers, it's probably good to remind ourselves, how does the legislative process work?
Thanks, Ashley. So I'll just give a quick, overview of this Congress. The Congress is comprised of two different chambers, the House and the Senate. A few differences between the bodies. I'm sure you might have heard this before, but the Senate is elected to 6-year terms. There's only two senators from every single state, regardless of whether you live in California, which has a population of over 40 million people, or smaller states like Rhode Island, Delaware, North Dakota, Idaho, for 100 senators total. The House, on the other hand, is elected to 2-year terms with only one representative from every district for 435 representatives overall. The House districts are all equal, relatively equal in terms of population, around 700,000 people per district. So those are the same no matter what part of the country that you live in. Everyone gets one, and that equals 435. Congress has several important committees that conduct work specifically to healthcare. On the Senate side, we have the Appropriations Committee, which has to do with all government spending and funding and different programs. The Health, Education, Labor, and Pensions Committee, which oversees critical agencies such as NIH, CDC, the FDA, and the Finance Committee, which oversees Medicare, Medicaid policy. And on the House side, very similar. We have appropriations, energy and commerce, which is the equivalent to the Health, Education, Labor, and Pensions or HELP Committee that oversees NIH, CDC, and Ways and Means, which is similar to the Senate Finance Committee that oversees Medicare and Medicaid. For anything to become a law, a piece of legislation has to pass both the House and the Senate, and then be signed by the president. And the same process applies to all bills, but specifically to also the appropriations process, which are must pass items every single year, because if Congress does not pass this measure, then it leads to a government shutdown. And legislators consider feedback from constituents as they support and prioritize specific efforts, which is why it's so important, to meet with them and talk to them about what's important for us.
Josh, thank you for explaining the key committees of the two chambers and how bills get passed. Can you tell us a little bit more about what is currently happening on Capitol Hill? What is Congress planning to focus on in this upcoming legislative session?
Thanks, Ashley. Well, actually, right now there isn't much going on. But just kidding. Yeah, there's a lot going on, so we just wanted to take the time to just give you the brief rundown of what is important and what's really happening. So as you know, a new administration has just taken office, and they're looking to implement their vision and legislative priorities as every new presidential administration does when they first come into office in their first 100 days. Congressional Republicans right now are looking to work with the White House and the new administration and are aiming to pass a reconciliation bill to address critical issues such as taxes, energy, immigration policy. And that effort is going to take up a lot of oxygen on Capitol Hill during the first half of the year. But we expect that legislators shift back to different priorities, including healthcare, later in the year once the reconciliation process is completed. At the same time, Congress also has a deadline coming up of March 14th where they'll have to pass a funding measure before the continuing resolution, which is a temporary funding measure that Congress extends government funding. That is expected to expire on March 14th. So they have to pass something, whether that is another short-term funding bill or concluding the process, the entire cycle for fiscal year 2025 remains to be seen. But the important thing is that Congress has to act one way or another before March 14th, or there will be another.
Great. Thanks for that, Josh. It's helpful to know what's happening right now in DC and when healthcare will be more of a priority. Now, Brian Perkins, our Foundation Director of Communications, is also with us today. Brian, can you tell us a little bit about how the Foundation can support our community members and their advocacy work?
Yeah, absolutely. So first and foremost, we have our regular communications channels. We have our Connections e-newsletter, we have Facebook, and things like that. And we'll share tips about how you can be a successful advocate, some success stories from our other advocates, and things like that. If you have an upcoming member meeting with a congressional office, the Health and Medicine Council, and the National Scleroderma Foundation, we can provide you with a copy of our 2025 legislative agenda and ahead of your meeting. So that will have some information about scleroderma and the foundation, and kind of all the things that are legislative and funding priorities, and a brief explanation as to why they're important. So if you would like that, if you have a meeting and you would like to have that, please email us at advocacy@scleroderma.org, and we'll get you those resources. And then the other thing you'll be on the lookout for is the foundation. We regularly send out action alerts that will include a sample letter that you can send to your member or members of Congress. The action alerts will relate to the peer-reviewed medical research program and other foundation legislative and funding priorities. So we try to keep you all updated as often as we can, and share as much information as we can and how you can help us along. Josh, once our community members have these resources in hand and they're ready for those meetings, can you tell us a little bit about what's the most effective way for them to share their story with lawmakers during a meeting?
Sure. Thanks, Brian. So it's very important to always begin these meetings by thanking the person that you're meeting with. Now, of course, we would all love to meet with, the senators, the members of Congress, but they have very busy schedules. So these meetings are generally with the staff members. So it's always very important to thank them. And you should start off by, telling them just about scleroderma, how it's affected you, your family, and your local community. Once again, the staff members or the members, they may have never heard of scleroderma. So it's very important to just briefly educate them, but also they want to hear about how it has impacted you, your family, but also your community, because they care about what's happening in their state, in their district. You should also talk about how you became, involved with the National Scleroderma Foundation, and just share more about, the work that National Scleroderma Foundation is doing, and how, you've been involved with them. And then finally, once you've, given them a brief recap of just scleroderma, the issues affecting your family and your community, the foundation, then it's time to shift to the legislative items. So you should discuss the legislative items and how they'll help the scleroderma community. Now, it's important to remember that you're not expected to become policy experts on the topics that we're discussing. That's why we'll have materials like the legislative agenda, and we can share other items that will be helpful in just giving a brief explanation of what these issues are and why they're important. And then finally, you should always leave some time at the end of these meetings to have the staff member ask any questions if they have any, because a lot of times one of the most common questions will be asking about how many people have scleroderma in the country, how many people have it in the States, if we have district-specific stats. So any questions like that, you don't have to necessarily know them off the top of your head, but it's important, to write them down, and then you can share it with National Scleroderma Foundation, the Health and Medicine Council, and then we can follow up with them. But once again, always important to leave a little time at the end, and then, of course, thank them again for taking time out of their very busy day to meet with you.
Thanks, Josh. It's great to know there is a way our community members can most effectively approach lawmakers. Now that we've covered the broader topics around advocacy, what are the current priorities for scleroderma specifically?
Thanks, Ashley. Yeah, so I'll just give a brief explanation of some of these items that you'll be seeing in the future, the stuff that we have on our legislative agenda. So, of course, our top priority annually is to ensure that scleroderma is included in the Department of Defense's peer-reviewed medical research program, which is essentially a program that many conditions can be listed in, and when they are, that gives researchers around the country the chance to apply for grants and receive money from the Department of Defense to do important research in scleroderma. And every year, the Senate indicates this list of specific conditions that are eligible, and it allows for all of these researchers, to apply and receive money. And it's important to note that this is a new list every single year. So, of course, scleroderma has, fortunately been included for many years in the past. But just because it was included in, let's say, this year, fiscal year 2025, it doesn't automatically just get included again in fiscal year 2026. You have to keep advocating for it every single year, because even though many conditions, stay on there and for years, each individual year is technically separate. So that's why it's very important not just to ask for fiscal year 2025, but to also keep doing it every single year and to the future. Other issues that are important for our community is, of course, funding for medical research at key federal healthcare agencies, such as the National Institutes of Health and the Centers of Disease Control and Prevention. And we also support critical legislation such as the Safe Step Act, that would bolster coverage of treatments for our community and help preserve the patient-physician relationship. Once again, just want to reiterate that you don't have to be expected to memorize, all the acronyms, all of the bills, the bill numbers. That's why we're going to provide you, with materials. And many of these meetings, we'll probably have either staff from Health and Medicine Council or staff from the foundation on there too, to assist with talking about some of the legislative items as well.
Thank you, Josh. We really appreciate you clarifying the scleroderma priorities for this year. How can someone living with scleroderma get involved with advocacy this year specifically?
Thanks, Ashley. Yeah, so this year there's going to be several opportunities to become more involved. This is going to take the form of virtual meetings, which we'll announce, in the future on specific dates for those, but also emailing your member of Congress with the materials that we send around in the action alerts. So our first action alert is going to be sent in February, and this is going to encourage all of you, our great advocates, to contact your personal member of Congress, your personal senators, and include scleroderma in the peer-reviewed medical research program for fiscal year 2025, while Congress is working to pass either the final or temporary funding measure by March 14th. So that's going to be the first opportunity. But once we get into the process for fiscal year 2026, which we expect to be hopefully by March 14th, but if not, a little later in the spring, once we get to that process, you may be asked once again to contact your representatives via action alerts, and you also may be requested to participate in some of the upcoming virtual meetings that I mentioned. And we'll announce the specific dates and more possible opportunities in the future. But for now, that action alert this February is going to be the main item to look out for.
Josh, this was such wonderful information for our community on advocacy for scleroderma. We greatly appreciate it. Now we have a few minutes for questions. As a reminder, please keep your questions relevant to our discussion today. We will not answer any political questions. So with that, we can unmute the group and see if anybody has a question that they would like to share.
Hi, this is Eva from New York City. I just wanted to add a little bit information, not only calling your representatives, but going to local civic meetings in your own area. A lot of our legislative officials are there, so we can, share our story, our 3-minute pitch, and try to get them on board to, to sponsor whatever bills that we would like them to sponsor.
That's great, Eva. Thank you for that.
Yeah, thanks, Eva. I'll just add onto that these congressional offices are also, these are the ones specifically based in the District of Columbia working on Capitol Hill, to pass all these, pieces of legislation. But these offices also are in constant contact with the local district offices as well. So if there's events, things going on in the community that are important, you can flag that during some of these meetings and they can report that back to the local staff that would be able to attend. So just an FYI there.
Looks like we have Gary Blankenship has a question.
Yeah, you mentioned some NIH programs. What exactly does, I'm somewhat familiar with the CDC and the DoD programs. What does NIH do for scleroderma research?
Yeah, so NIH, just for those that aren't familiar, is the leading agency for healthcare research and research funding in this country. So NIH tackles research for all all medical conditions, and the way, so obviously that's a lot. So the way that they're divided is into 27 different centers and institutes. So for scleroderma specifically, NIAMS, the National Institute of Arthritis and Musculoskeletal and Skin Diseases, is the one that we focus on the most. But essentially what they do is they give a lot of grants to different institutions all over the country. So when we ask Congress to give $48 billion overall, a specific amount of that will go to NIAMS and go to all of these specific institutes as well. And then they use that money to give out grants, awards to different institutions, researchers all over the country. So all of that is coordinated, at NIH, NIAMS, but more money for NIH overall means there's going to be more money for NIAMS and more opportunities for them to award these grants to, all of the great, researchers around the country that are, studying scleroderma and looking to improve treatment outcomes and understanding of it.
Do you know roughly how much goes to scleroderma grants?
I can actually look that up right now. If you just give me one moment.
Okay. I don't want to monopolize. I just had one follow-up question. We're hearing a lot about NIH shut down, not shut down, just communications. Is there been any, what's the real story? Has there been any effect on their day-to-day operations beyond just communications, or are they not operating?
Yeah, so our understanding is that the new administration put what was supposed to be a temporary freeze on external communications, meetings such as advisory council meetings, which are done by every single NIH institutes 4 times a year. Many of them were supposed to happen last week and the week before. Those have been postponed. So currently, yes, that's correct. NIH is under kind of a freeze of external communications, these public meetings. But we expect it to be lifted, relatively soon.
Thank you.
Thanks, Josh. And great question, Gary. Our CEO, Mary Wheatley, is here. Mary, is there anything you would add to that around NIAMS and NIH?
Yeah, I would just add that we have great working relationships with all of the institutes that fund scleroderma research, including the Office of Autoimmune Disease Research, which is a newly formed office that is helping to coordinate autoimmune disease research across all of the institutes. And our vice chair of the board and committee chair for our committee on research, Dr. Carol Fagali Bostwick, noted in the chat that the National Heart, Lung, and Blood Institute is also an important institute for us. And so we work closely with that group as well. And Gary, you just asked about, how much NIH funding goes to scleroderma research every year. It varies depending on the number of applications, but it's anywhere between $8 to $12 million. And sometimes much, much more. So there can be large center grants that many of our designated research and treatment centers have that include training and research for scleroderma. For fellows who are interested in research and large-scale research projects, as well as the traditional kind of R01 type research grants. Carol, anything that you would add there?
Oh, that was perfect. I think when we looked over the years, the average yearly funding for scleroderma was about 11 million, but advocacy is important because there are diseases that are less common than scleroderma, not making any light of other diseases that have more funding because of the advocacy efforts behind those diseases. So it does make a difference if we speak up in terms of boosting the funding that is allocated to scleroderma research.
Wonderful. Thank you, Carol, and thank you, Mary. Actually, our chair of our Advocacy and Awareness Committee and a board member of the foundation, Courtney Caliendo, is here with us today, and she has a question as well. Courtney?
Hi, everybody. I'm Courtney. I have a question for Josh because we have talked a lot about when we have our meetings or if you have your meeting or this is the information you should talk about. But maybe there are some of us on the call or we can talk to. How do you get the meeting? What are those first steps that we as advocates need to take? Is it as simple as calling your congressional office? Like how do you get to the meeting?
Great question.
Thanks, Courtney. Yeah, so the good news is that that's something that none of you, the advocates, have to worry about. That's my job. That's the Health and Medicine Council's job. So once we know specific dates and confirm availability to have meetings, we set all of them up. So let's say that we were having a virtual meeting, on February 25th. We would send out a meeting request to the congressional staff, and we have a directory for all of that. And we would specifically send that to what's called the Health Legislative Aide, which is the staff member in congressional offices that specifically handle healthcare issues. So they should be knowledgeable to many of the stuff that we talk about in terms of NIH, CDC, the peer-reviewed medical research program. But we set all of that up. We'll confirm the meetings, the times, the availability. We also sometimes set up the Zoom, whether it comes from Health and Medicine Council or it comes from the foundation. But we coordinate all of that, so it's not anything that you have to worry about. We'll make sure that you know the times. We'll make sure that you have all of the necessary materials. And then, of course, we also, attend, when we can, the meetings themselves to just help facilitate and provide some additional context and background information.
Great. Thank you so much for clarifying that.
Thanks, Josh. That was a great question, Courtney. Any other questions from the group while we're still here? Looks like we have addressed every question from the chat. Oh, Mary. I see Mary Blades from our board of directors.
Okay, am I on?
You are.
Yep.
Okay, I have a couple of things. One is that the follow-up after these meetings is so important. If you just have the one meeting and you go away, you'll go away. So be sure that you do a follow-up. And you can keep in contact. I wouldn't say it once a week or once a month, but To me, the follow-up is very important. The other question is, I had a question in the chat about state stats. Mary, is that going to be part of the resource package? How do we find out state stats?
So depending on which meetings we have scheduled with members of Congress, that will be part of the package. And we do have access to state information. It depends on what our issues will be. But certainly for NIH funding within their district and the economic impact of that, as well as access to care within their specific districts.
Okay, thanks.
That's great. Thanks, Mary. Mary, while we have you here, Mary Wheatley, do you also want to just briefly mention some of the work that we do with other organizations? I know we mentioned a few, but with other organizations and coalitions?
Sure. So coalition work is a huge part of our advocacy work, and we're a member of probably about a dozen coalitions. And coalitions are a great way, and Josh can certainly speak to this as well, but a great way to leverage our impact as part of a larger group. So a couple of the coalitions that I'll just highlight. One is actually the NIAMS coalition. So Josh talked about the importance of advocating for increased NIH funding. And one of the coalitions that we work with is the NIAMS coalition. And it's a coalition of organizations who fall kind of under that umbrella of arthritis, musculoskeletal, and skin diseases. And so us and similar organizations who are in those disease areas come together and educate members of Congress about the importance of funding research and training in these disease states and why this is so important for our patient communities. Another group that we work really closely with is the Autoimmune Association. And so we have a national coalition for autoimmune patient groups. And that's another really powerful way to have a collective impact and just maximize for what may be small patient populations to really come together and speak with one voice around a specific group of diseases. Anything you would add there, Josh, about coalitions?
Yeah, I think it just definitely speaks to just kind of the point I was making about advocacy overall. There's always, strength in numbers. When advocates from all over the country, whether that be in, less population states like Hawaii, Rhode Island, Montana, West Virginia, to Florida, California, Texas, New York, when we're all making our voices heard to our members who represent different states, different districts, it really does make a difference. It makes our, name and our disease more, visible on Capitol Hill, so that when we, go into offices in future years, they don't say, "Oh, I've never heard of scleroderma. I've never heard of, the foundation." They say, "Oh, I remember, that great meeting with these advocates. I remember, meeting them in person." Whatever it may be, it's always good to have, as many people from as many, broad, diverse, parts of the country, as we can, all advocating together for the same priorities.
Thanks, Josh. We have a couple of other questions that have come in chat. And so one of them is from Jill Seaman, who is amazing and also involved with advocacy work. Her question was that in the past, they used to get petitions signed to take legislators along with their action alerts. Is that still something we do, the petitions? Do you know, Josh?
I mean, I haven't. It's possible that we've done that in the past. Phil has obviously been working, with the foundation for much longer than I have. So, but yeah, it's definitely something that we can, like discuss, in the future. I don't see there'd be no reason why it would be like a bad idea or anything.
Sounds good. So, Jill, that'll be a good item for follow-up. And then what other things should you not discuss or do when meeting with a legislator?
Yeah, that's a good question. I mean, yeah, the main thing I'd say is to just, refrain from expressing like personal political opinions about,
Right.
especially their boss, or about, other national political figures, because it's just make ourselves known, but not in, a good way. We don't want, offices having a negative impression of us. So the most important thing is always to just sticking to the main issues, because this is something that, we tell, a lot of advocates from many different groups that we work with that, sometimes you might go into an office of a member that, you might not be the biggest fan of. And then it turns out that actually that member is a great champion for us, is really helpful on our issues. So I'd say that it's very important to, always just keep an open mind because of course, it's natural, to have like personal beliefs, but ultimately working, in a bipartisan fashion is the best way to get things done on Capitol Hill. And the great thing is that our programs that we advocate for within the DoD, NIH, CDC, even the bills, they have hundreds of co-sponsors. So they have broad support across the aisle, and we're not talking about issues that are particularly divisive or are going to generate a strong negative reaction from any office that we meet with.
That's great. Thank you for that, Josh. We do have another question that's come in, and it's a great one. So with all the changes in Congress and changes in actual legislators who previously supported our issues, are there a lot of new relationships that need to be developed?
Yeah, of course. Yeah, this is a good question. So the answer to that is, we always want to make as many relationships with different offices on Capitol Hill, whether they are, brand new freshman members. So, this year is a great opportunity because, there's a good chance that, for example, if you live in Pennsylvania, that means that you have a new senator. And I know that there's been a couple of changes on the House side as well. States like Michigan, Arizona also have new senators. So it's important to, of course, make first contact with, the brand new freshman offices. But there's also a chance that, especially for any new advocates that we've never met, with that personal member of Congress, senators are a little more likely just because they represent an entire state. But there's always offices that we probably couldn't, be in contact with more. So it's important that as many of these offices on Capitol Hill are aware of us, and aware of our priorities. It's very difficult to, have congressional champions, in every single, state, every single district. There's 500 total members, but, the meetings that we're doing is going to help make our voice, known by, numerous, key offices on Capitol Hill.
Thanks, Josh. These have been some really great questions. I think we are at the end of questions unless anyone has any other burning ones they want to share with the group. So it looks like we are all set. So I just want to thank everybody who joined us today. We have an amazing community, and it's always so nice to see everybody. We appreciate your ongoing dedication to finding a cure for this disease. Anyone with questions or an interest in advocacy, please send us an email at the same address that Brian mentioned, advocacy@scleroderma.org. We'll be keeping an eye on that, especially close the next few days since all of you are here with us today. Josh, thank you again for taking the time today to discuss the importance of making our voices heard on Capitol Hill. We look forward to a great year of advocating and making a difference for the scleroderma community. And with that, I will say goodbye to everybody. I hope everyone has a great rest of their day and week. And thank you again for being here.